You're 81 years old with bad circulation and bad heart disease. You're having chest pain every day and the medications aren't working. What should your next step be? So Camille, tell us about this 81-year-old lady with bad heart disease and poor circulation.
So she has had a heart attack in the past, and then she also had a recent heart scan in the last year that showed a moderate amount of the heart had new blockages. And because of this, she was getting out of breath very easily, having almost daily chest pain, and getting progressively more tired over time. She wanted to know what else could be done because she was already on a lot of medications. But she also had some concerning symptoms in the feet because the bottom of her feet would be painful frequently, and it was more notable with exercise. So we were really concerned that she had severe peripheral vascular disease as well.
Yeah, it's interesting. This is a common problem with people with a condition of circulation problems, heart disease and poor circulation in the legs. There's a term called atherosclerosis. That just means hardening of the arteries. We have a buildup of plaque in the arteries. And this buildup of plaque in the arteries affects the arteries' abilities to dilate and constrict. It also reduces flow of blood to the heart, to the brain, to the legs. And we see patients who essentially feel miserable. And this is the case with this patient. She was simply miserable in her presentation. So what were our initial findings?
So she had high cholesterol, and she couldn't take the statin drugs due to liver injury in the past and severe muscle pain. She had an elevated blood sugar, so she was in the pre-diabetic zone. And she also had a high lipoprotein (a), which is highly genetic but partially influenced by the diet and definitely increases the risk of plaque formation. And we know that up to 30% of those who've had a heart attack in the past are going to have another heart attack in the future. And then on her peripheral vascular studies, we found 30% up to 100% blockage in some of her arteries.
You know, it's just interesting, her being on a statin drug. Of course, she didn't tolerate the statin drug, but having a diagnosis of prediabetes, oftentimes statin drugs can potentiate diabetes. And so that's certainly a complication of a medication that's intended to help this condition, but can also bring on other problems. And what many people don't know is that you can reduce Lp(a) with a proper diet. And we've actually shown that in our scientific work, and we've published it in the scientific literature. So what was our plan of intervention for this patient?
So we consulted with the nutrition team and the culinary team to design a specific dietary plan to focus on reducing the hardening of her arteries. And she did really well with that diet. It was raw plant foods levels 0 to 4B. And we also did the ozone therapy. So she had 4 ozone IV therapies in the form of EBU, and that helps improve mitochondrial function or energy production in the cells, reduce inflammation in the whole body. And she also did the IV infusions we call Plaque X. So that's a molecule that helps remove the plaque from the arteries, and the nice thing about that, it does that systemically, so it's not just tailored to fix blockage in the heart, but it can help the legs, the carotid, cerebral vascular disease as well. And we also added the curcumin, which is a supplement. It comes from the root vegetable turmeric, which helps to reduce inflammation.
Wow, that's some pretty impressive treatment plan you outlined. And just for clarification for our audience, the nutrition plan that you described was what we actually showed that reduces Lp(a). So these infusion therapies, along with a very powerful diet, all had a synergistic effect in helping turn around this advanced illness in this patient. How did she do?
So she did great. She no longer had any chest pain or shortness of breath, and the foot pain that occurred at rest went away as well. When she was walking, she would still sometimes get pain in the feet, but less frequently. And in that 1 month, she lost 12 pounds, and she also reversed her prediabetes. And during this time, her medications were reduced in half. And then she also lowered the bad cholesterol by 18%. And that lipoprotein (a) we've been talking about, that was reduced by 34%. And then we also redid the studies that look at the circulation. And the vessels below the knee, the blood flow had improved in those by 25 to 50%, which is really substantial in that period of time. And then we also redid the heart scan. So the initial heart scan showed a moderate amount of ischemia or reduced blood flow. When we repeated it, that was no longer there, and the blood flow in the heart had normalized.
Amazing. So what period of time did all this occur?
4 weeks.
Wow. So again, this shows you how powerful this intervention is. And I want to emphasize that we had a number of therapies, the nutrition, the infusion therapies, all working together synergistically to help the body heal itself. And when this happens, it can be very, very effective, and we're able to reduce these medications. So this is a very powerful intervention, and this patient at the young age of 81 years old with severe disease had a very significant turnaround in simply 4 weeks. So I hope you got a lot out of this, and as usual, if you have any questions or comments, place them in the comment box, and until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.